Now, most people think that you need a bachelor's degree to get into medical sales. That is not true. Now, the part that nobody explains is that you don't override medical sales positions that require a bachelor's degree. You find the positions that don't require one, and then you showcase your skills to get that position. And that's how you get into medical sales without a bachelor's degree. In this video, I'm going to show you which medical sales roles often do not require a bachelor's degree, why an associate degree absolutely carries weight in the medical sales industry, and what actually replaces a bachelor's degree in the hiring decision. Let's get into it. Now, according to a lot of LinkedIn job postings, MedReps, heck, even Indeed, I don't really recommend Indeed to go look for medical sales positions. Sometimes they're there, but I usually encourage LinkedIn or just going to the companies and the actual websites, to the career pages of the companies themselves. You'll see oftentimes bachelor degree preferred, not required. That's a big difference. A big difference to notice, a big difference to be mindful of, because it speaks volumes into what your opportunities are. Now, of course, there's going to be spaces and positions that say bachelor degree required. And it's hard pressed to try to fight that or override that, right? Because you're going against scores of people that have bachelor's degrees. Even if you go head to head with someone and the skills are the same, the personalities are both appreciated, they love everything you're doing, everything they're doing, and you might even both have relationships. If that person has a bachelor's degree, they have the edge. It's as simple as that. But if you look at the roles where a bachelor's degree is preferred and not required, or in some cases, the roles where they don't mention a bachelor's degree preferred at all, then those are absolutely roles you can dive into and have the full confidence that you're going to give yourself a strong shot. Now, with all this being said, I want to be abundantly clear. There are a few industries that absolutely require a bachelor's degree for the most part. So the first one that I think just needs to be plainly stated is pharmaceutical sales. Now, there have been cases where very small, almost distributor-like pharmaceutical sales companies have entertained someone that has a strong record of sales and does not have a bachelor's degree. But for the most part, most pharmaceutical companies require a bachelor's degree. Now, why is that? You have to look at it in the vein of regulation. Pharmaceutical sales is probably out of all of med sales, pharmaceutical sales is probably one of the most regulated spaces in medical sales, because you're talking about drugs. There's a whole score of issues that come with drugs when it comes to contraindications and side effects that all have to be masterfully addressed by the company selling the drug. And if they have a sales rep in that position representing whatever, then they want to make sure that sales rep represents it powerfully, safely, and having a bachelor's degree does indicate that you've been through something, some formal training of some sort, where you were required to show up a certain way with a certain cadence and a level of responsibility, and develop a pedigree of work ethic and grades that give an outcome that says, okay, if I don't know anything about this person, they at least went through this process that gives me that level of trust in what their capabilities are. Does it really speak to what the person can do or cannot do? Between you and I don't think so. I absolutely support and believe everyone should get a bachelor's degree if they have the opportunity to. I think it sets you apart. I think you get access to things you might not have access to otherwise. I think that training and that repetition does build certain skill sets within you. But do I think that because you have a bachelor's degree, you're better than someone that doesn't? Absolutely not. But in the highly regulated pharmaceutical sales industry, a bachelor's degree is usually required. Another space that not every role, but a lot of the roles, the lion's share of the roles are bachelor degree required, is enterprise level medtech. So what exactly does that mean, enterprise level medtech? I'm talking about the large companies, the Boston Scientifics, the Strykers. A lot of those companies, for a lot of those roles, require a bachelor's degree. Enterprise level, it's an easy way to screen qualified candidates. So let's talk about that for a second. Again, someone that has a bachelor's is not better than someone that doesn't have a bachelor's. However, when you're looking at the skill sets of an individual, and if they're qualified to do a job, having a bachelor's does set apart from someone that doesn't. If you only graduated high school and you haven't put yourself through any training of any sort, and you've went through a 4-year degree and you came out with really good grades, maybe some extracurricular activities, you are saying, you're communicating that, look, because you don't know who I am, you don't know what I'm about, you don't know how I show up. When you look at what I've done at face value, the person that graduated high school, at face value, they haven't done anything. Now, that might not be true, but at face value, that's what it looks like. Whereas a person that graduated from a 4-year degree, at face value, they've went through a curriculum, a structure. If it's a reputable college, an intense curriculum, intense structure. If they got great grades, they were able to operate at a bar that was set through a curriculum, through a structure, and deliver on an outcome, a desired outcome. And for some cases, a lot of cases, the person that is showing up this way, that went through that 4-year degree, they're doing all these extracurricular activities that enhance their profile and make them look more capable. And when you're an enterprise level medtech company that has thousands of candidates that are trying to vie for these positions, an easy way to separate the most likely capable versus the most likely not as capable is using a bachelor's degree. It's not rocket science. It's not mean. It's just what is. But it does not mean that you, who does not have a bachelor's degree, can't get into a role at one of these types of companies. It does mean you have to do the due diligence. You have to sift and really find those roles that either have bachelor's degree preferred or no requirement at all. And there are roles that have no requirement at all. That's the beauty in all of this. If there's anything you take away from this video today, take away that if you don't have a degree, if you have an associate's degree and you're thinking to yourself, you know what, I'm in my mid-30s or 40s, and I have a great career, I have all the success. I want to be in medical sales, but because I have an associate's degree, I guess it's not for me. You're wrong. I'm going to say it plain as day. You are wrong. You absolutely have an opportunity. You just have to spend a little bit more time. So let me speak directly to all of you that are listening right now or watching this and have an associate's degree. So an associate's degree actually speaks volumes to positions in medical sales. And there are 4 things that are great about having an associate's degree. They should actually be toting, okay? Number 1, academic achievement. It's an academic completion. An associate's degree, no matter how you cut the cake, it is a level of academic completion beyond high school. That counts for some. Number 2, baseline discipline. To get an associate's degree, you can't not show up to class. You can't not do the work. You can't not turn it in. You have to have a level of discipline to get through that 2 years of whatever is required to end up being able to say and put on a record that I have an associate's. Number 3, it signals commitment. You were committed to something. Whether you knew exactly what it was going to do for you or not, you made a decision, a proactive decision that was not required by any entity, right? Because high school's done. High school, you got to get through high school. That's done. You made a proactive decision to put yourself into something to further your life, and that signals commitment. And then number 3, a lot of associate's degrees require some level of technical training. What are we doing in these medical device positions, in these associate sales roles, in these clinical specialist roles? A lot of them are very technical. It's medical devices, it's medical sales, it's medical supplies. I mean, we're talking technicality upon technicality. And when you have an associate's degree in something technical, again, it speaks volumes to your level of understanding that you absolutely tote. An associate's degree counts for something. And if you're listening right now and you have an associate's degree, then medical sales, if you've been wanting this space, can absolutely be the space for you. So let's do a quick recap. The secret to not having a bachelor's degree and getting into medical sales is not about overriding positions that require a bachelor's degree. It's about identifying the ones that don't. So let's look at this. Number 1, identify the roles that do not require a bachelor's degree in medical sales. Remember, as we've just discussed, stay away from pharmaceutical sales to kick that journey off. If you're looking at enterprise level med tech, make sure you're diving deep to see if it's bachelor's degree preferred or not required at all. Where you can spend a lot more time are distributor level companies. I'm sure some of you that have been on this medical sales pursuit have heard of companies like Arthrex. Companies like that are large distributors and even smaller distributors, especially smaller distributors. A lot of them have a lot of roles that might not require a bachelor's degree. So again, find the roles that do not require a bachelor's degree. Either bachelor degree preferred or no bachelor degree at all. Number 2, when you find those roles, take note of those companies and give yourself a list. 10 companies that contain those roles that do not require a bachelor's degree or it's bachelor's degree preferred, and start networking to the individuals that have those roles in those companies. And then number 3, build the skill sets. And let me say this a little better. Make sure you can communicate that you have or have built the skill sets that are required in these roles. At the end of the day, if you're a hiring manager and you're looking for true talent, what you really want to know is, if I hire this person, will they be able to do the job? Sure, a degree helps. Sure, a degree from this great university can help. But you're less concerned about the degree and where the degree came from, and you're more concerned about what are the capabilities this person can actually execute. And actually, if there's much more that speaks to actual data on what this person can execute, it is more important than what degree this person has or where it came from. Because when you're looking at your team and you're expecting things to happen for this team you put together, you're expecting this person you're hired to deliver. And usually when someone has repeatedly demonstrated success in all these different areas in their professional trajectory, there's a high chance they're going to come into your team and do the same thing. So make sure you focus on the skills that are required to do this job and be able to communicate powerfully how you can do those skills. So some of the skills that really speak volumes about who you are for any role, and especially for roles where a bachelor's degree is preferred or not required at all, and you're trying to see how you can communicate your value. Number one, clinical experience, clinical familiarity. If you're a scrub tech, if you're a medical assistant, if you are, of course, if you're a nurse or PT or OT or anything like that, but that's well beyond a degree. Actually, it's not true. Some nurses don't have bachelor's degrees, but a lot of professionals in those spaces have bachelor's degrees. But if you're a scrub tech, if you're a respiratory therapist, if you're a medical assistant, a lot of professionals in those spaces might not have a bachelor's degree. They might have an associate, or they might have some type of specialized training. But what they all share is clinical familiarity. They can literally speak to what happens in a clinical setting, what the patient experiences, what the doctor experiences, and what professionals like themselves experience in the sequencing of doctor, nurse, medical assistant, office manager, all the way to patient. Just being able to understand how that works and how that flows speaks volumes. And if you've been in a role like that, you've even had the opportunity to work with medical sales professionals. Again, it speaks volumes. And this hiring manager that's trying to consider who can join their team and who can really hit the ground running if they're given the opportunity, has the confidence that, look, this person might not have a bachelor's, but they have an associate's degree and they clearly understand what my business requires. They understand what it looks like from the patient interaction side. They understand what it looks like from the physician interaction side. And if there's any other decision makers that are intertwined in that process, they also understand what happened. That is huge. So number one, clinical experience and clinical familiarity. Number two, relationship building in a demanding environment. This one is huge. I think years ago, when we first started working with waitresses and waiters from the restaurant industry that wanted to be in medical sales, it was such a big challenge because we were faced with how do we position these professionals to really look like they can deliver in this type of clinical environment, only to realize that a lot of these waiters and waitresses had some of the best experiences because in the hectic, demanding environments that they were serving in, or when it was a five-star restaurant with a demanding customer base and a great reputation, and it was very fun to showcase their skills into how they can translate that into how they'd show up in a busy clinic or a hospital. It was fascinating, and it spoke volumes into what it means to be someone that can express that you can drive and build relationships in a demanding environment. The same thing with chefs, the busy kitchens, things are all over the place. It was kind of amazing to see how well it translated into medical sales. So if you're in an environment that's really hectic and really demanding, and you don't have that clinical familiarity, and you don't have that bachelor's degree, don't count yourself out. This is an opportunity for you to take something that you normally deal with, that you've normalized this demanding, hectic space, this environment, into something that you just deal with and can produce outcomes, consistent desired outcomes on a regular basis. That's exactly what the medical sales space needs. So you're someone that's a good fit for this position if you've wanted to be in this kind of space. Don't count yourself out. Again, someone that can develop relationships in very demanding environments, a great skill to really communicate powerfully when it comes to what translates into medical sales. Number three, territory discipline. So if you're in a sales role, and I'm not talking about just a B2B sales role, we'll get to that in a second. I'm talking about any type of sales role, maybe B2C sales role, insurance salesman, or something of that sort, and you're responsible for an area or a territory, or maybe you're in logistics and you're responsible for an area or a territory. This can communicate and translate really well. Communicate powerfully into what's needed for medical sales because you were given an area and you're responsible for the output of that area, regardless what the product was. The point is you were responsible for driving revenue within an area that was all yours. Again, that is territory performance. That speaks volumes for someone that's trying to showcase the skill they bring to a medical sales role. And if you don't have a bachelor's and you have something like this that you've been doing in your career and you have documented success, then and you've been thinking about medical sales, then medical sales can absolutely be for you because you can powerfully communicate how this translates into what's required for these roles. And then lastly, B2B sales. Now this one's kind of a no-brainer. It's kind of an open secret now that if you have a lot of documented B2B sales experience, you have a really good chance of getting into medical sales. And I'm here to tell you that it's absolutely true. The cool thing about having B2B sales is a lot of those B2B sales roles, you're required to go out there and bang on doors, be told no over and over and over again, and still wake up the next day full of vigor, full of excitement, full of focus, with your listening skills intact to go out there and try to get someone to get involved and drive the business. And if you can do that from whether it be copy machines to wine, to knives, to cars. If you're good at this, then it speaks volumes into your capabilities if you were to bring that into a medical sales role. But I do want to spend a moment here to address why B2B sales is so regarded. It's not just because you're selling stuff. It's because usually in B2B sales, the product can be commoditized, meaning there's a lot of competitors and the customers can choose whatever they want from a huge array of options. So if you're given this product and you were able to find the way to get your product to be the one that was chosen over and over and over again in a position where you exceeded goals over and over and over again, then it really speaks to your capabilities as an individual. Not just that you have sales chops, but that you are someone that does not give up. You're tenacious, you're focused, you find opportunities, and you turn those opportunities into business. And that's what medical sales is really looking for. They're looking for tenacious people that don't give up. They care deeply about what they're selling. They care deeply about the impact they're making, and they find the opportunities and they drive business. And they're so hungry to be successful that they do it over and over and over again, regardless what the market is doing. So when you really think about it, all of you that are listening to this and don't have a bachelor's degree, this is what you're trying to bring to the forefront, that you're one of those individuals. Regardless what you've been doing in your space, you want to showcase that you're the hungry individual that gets after it, makes it happen, turns over every single stone until they find the opportunity and drives the business because they care about what they're doing and they want to win. Now, can you just go into an interview and say that? Sure. Is that going to get you the job? Probably not. You have to be able to demonstrate. And this is where whatever you're doing comes into play. Whether you're a waitress, whether you're in B2B sales, whether you're a medical assistant or a scrub tech or a respiratory therapist, regardless what your background is, you got to be able to take that background and show that you're that kind of person with what you've done. That's going to be your biggest opportunity when it comes to getting interviews in these medical sales spaces. Now, if you have no degree, no sales experience, no clinical exposure, absolutely no discipline, and you're not willing to prepare for anything, then you're probably right. Medical sales is just not for you. But if you're willing to strategically target the right roles, build the right profile, and get prepared the right way, then you can absolutely become a player in the medical sales space. And I will be the first one to tell you that medical sales and the amazing career it can give you can absolutely be free. Most people watching this will probably eliminate themselves. Not because they can't compete, but because they assume they can't compete. But the real difference between someone that does not have a bachelor's degree and gets hired versus someone who doesn't is strategy, pure and simple. So if you're someone that wants to get in this industry and you're serious about being in medical sales, not just watching videos on YouTube all day, then make sure you click the link below. But only click if you're ready to execute, because this is where the serious get exactly where they want to go.